A muscle cramp is an involuntary and forcibly contracted muscle that does not relax. When we use the muscles that can be controlled voluntarily, such as those of our arms and legs, they alternately contract and relax as we move our limbs. Muscles that support our head, neck, and trunk contract similarly in a synchronous fashion to maintain our posture. A muscle that involuntarily contracts is in a spasm. If the spasm is forceful and sustained, it becomes a cramp. Muscle cramps cause a visible or palpable hardening of the involved muscle. Muscle cramps can last anywhere from a few seconds to a quarter of an hour or occasionally longer. It is not uncommon for a cramp to recur multiple times until it finally goes away. The cramp may involve a part of a muscle, the entire muscle, or several muscles that usually act together, such as those that flex adjacent fingers. Some cramps involve the simultaneous contraction of muscles that ordinarily move body parts in opposite directions. Any of the muscles that are under our voluntary control can cramp. Cramps of the extremities, especially the legs and feet, and most particularly the calf, are very common. Involuntary muscles of the various organs are also subject to cramp.
Sprains and strains. Sprain is caused by a ligament being stretched too far from their normal position or sometimes when it is torn. Commonly injured ligaments are in the ankle, knee, and wrist. Ligaments are the thick, tough, fibrous bands of connective tissue that connects one end of a bone with another. Strain is an injury of a muscle or tendon being torn or stretched too far. Muscles move your skeleton. When it contracts, it pulls on a tendon, which is connected to your bone. When muscles are stretched too far or when stretched while contracting, an injury may result. A sprain is caused by direct or indirect trauma that knocks a joint out of position and stretches, and in severe cases, ruptures the supporting ligaments. As chronic strains are the result of overuse of muscles and tendons. Acute strains are caused by a direct blow to the body, overstretching, or excessive muscle contraction. While the intensity varies, pain, bruising, swelling, and inflammation are common to all three categories of sprains: mild, moderate, and severe. Typical indications of a strain include pain, muscle spasm, muscle weakness, swelling, inflammation, and cramping. Myositis is the medical term for muscle inflammation. In myositis, inflammation damages the fibers of a muscle. This causes muscles to be weak by interfering with the ability of the muscles to contract. Although myositis can cause muscle aches and muscle tenderness, weakness is usually the dominant symptom. In some cases, myositis is a short-term problem that goes away after a few weeks or days. In other cases, it is a part of a chronic or long-term condition. Chronic forms of myositis can lead to muscle atrophy or wasting and shrinking and severe disability. There are several types of myositis, which are idiopathic inflammatory myopathies, including dermatomyositis, polymyositis, and inclusion body myositis, infectious myositis, benign acute myositis, myositis ossificans, and drug-induced myositis. Causes of these myositis are either a viral infection, trichinosis, eating meat that has not been cooked enough, a lump of bony material forming in a muscle which may hurt when you press it, or a side effects of a medication or a combination of medicine. For treatment, you should rest in bed and drink plenty of fluids. You can also take non-prescription medicines for fever and muscle aches.